Continuing with sleep medicine and physical therapy, Part 5, Physiotherapeutic Resources to Improve Sleep. Today's topic, Hydrotherapeutic Resources for Sleep Management. I'm Chris. The use of water as a resource for treating several clinical conditions is probably as old as humanity and can be used in three forms, solid, liquid, and gas. This technique is related to naturopathic intervention, and it receives several denominations, such as cryotherapy, hydrotherapy, hot bath, inhalation, sauna, swimming, aquatic therapy, aquatic physiotherapy, among others. More important than knowing and mastering hydrotherapeutic techniques available on the market, it is necessary to have the knowledge of the physical properties of water, the physiological and therapeutic effects of water, and the influence of such effects on the different body systems existing. This chapter aims to improve the physiotherapist's skills in how water can be used to aid sleep complaints and disorders, both as an adjunct treatment to other therapies and as a treatment per se. With the millennial fascination for water and the development of science, we currently have many papers involving water as a non-pharmacological strategy for the treatment and prevention of several clinical conditions, and with a focus on maintaining physical and mental health for both genders, from newborns to elderlies. The sleep outcome is introduced in some of these papers. Hydrotherapeutic intervention proposals are based on the physical and therapeutic properties of water: density, hydrostatic pressure, fluctuation, viscosity, and heat, and their respective physiological and therapeutic influences on the immersed body. The therapeutic utility of water depends on its ability to retain heat and transfer thermal energy. Water can therapeutically be used in a wide range of temperatures depending on treatment objectives. Hot water bath. The use of heated water as bath near bedtime and having total or partial immersion of the body has been proven to promote muscle relaxation, with a consequent decrease of muscle tone and increase of peripheral blood flow and heat dissipation through peripheral vasodilation. These events result in a decrease in the activation of the sympathetic autonomic nervous system, thus facilitating quietness behavior, with consequent decrease of sleep onset latency, and also ensuring the restorative sleep. An investigation with older women with an average age of 60 to 72 years old and with insomnia diagnosis addressed the sleep changes caused by passive body heating, immersion in hot water in a bathtub. The participants underwent two baths with different controlled water temperatures. First, ranging between 40 degrees Celsius and 40.5 degrees Celsius, and second ranging from 37.5 degrees Celsius to 38.5 degrees Celsius during 2 consecutive nights, for 3 minutes immersed until the level of the chest. The baths took place 90 minutes before the usual time of sleeping. The sleep period was then monitored by a polysomnography, and the participants also answered specific questionnaires on sleep quality. After bathing with water temperature between 40 degrees Celsius to 40.5 degrees Celsius, there was a significant decrease in the number of awakenings after the sleep onset, and an increase in the amount of slow-wave sleep. In both temperature ranges, the participants reported an improvement in the perception of sleep quality. Correspondingly, when they answered the post-sleep questionnaire, they considered that the sleep was deeper and more restorative, and felt more willing to wake up in the morning. Exercising in water. Sleep and wakefulness regulation is well synchronized by two processes called circadian and homeostatic. The sleep pressure imposed by the homeostatic process S, depends on the energy expenditure throughout the day, and most often people who cannot enjoy restorative sleep cannot have enough energy to perform regular physical activity, becoming increasingly sedentary and susceptible to increased body weight and other unfavorable clinical conditions that will negatively impact their sleep quality. The incentive to exercise in the aquatic environment is generally well accepted because it is more pleasant to perform intense exercise than in the ground, whether they focus on the muscle strength gain, cardiovascular, individual, or group fitness. Thus, with greater energy expenditure, there will certainly be greater pressure on sleep. It is important to emphasize that group activities promote the socialization of people with a tendency to social isolation, impacting positively on anxiety and depression symptoms. Aquatic exercise also supports the body weight and reduces stress in the musculoskeletal aspects that are very important for the elderly because it decreases the risk of falls, which is commonly a barrier to perform ground exercises. Hydrotherapy. In addition to the proposals of passive body heating without the direct intervention of the physio, there is a well-known technique in the literature called Watsu, in which physio takes the patient in his arms and leads him passively by the heated pool, combining muscle and mental relaxation, stretching, joint mobilization, and shiatsu. The Watsu method is recommended for people who of any age with acute or chronic pain complaints, and is also indicated for people with sleep complaints. A hydrotherapeutic method used to gain muscle strength and improve body perception is named the Bad Raggett's Ring method. A recent study, while not directly investigating the sleep variable, found that by proposing and performing hydrotherapeutic intervention via Bad Raggett's and Aichi aquatic methods for participants with low back pain, complaints decreased after 4 weeks of treatment using these methods. Final words. Although there are several hydrotherapeutic techniques, it is worth noting that the most important is to have knowledge about the physical properties of water, selecting the appropriate and pleasant temperature for the patients in an individualized way, and proposing an intervention that meets the specific needs of and objectives of the patient. This can be through hydrokinesiotherapy, referring to specific approaches aimed at mitigating the consequences of clinical approaches. In this way, physio will be assertive in promoting a good night's sleep with consequent positive effects in the waking period. Although in clinical practice we realize that hydrotherapy presents promising results mainly for sleep disorders that require prior relaxation, like insomnia. There are no consensus and guidelines or research in the theme that calls for 100% of this practice. Thus, further scientific research is needed using population representative samples, disease-specific, focusing on the use of water resources specifically related to the improvement of sleep. I'm Chris, physiotherapy student. This is the topic of hydrotherapeutic resources for sleep management. That's all for today.